we tend to leave our mental health issues to the extent where it's in a crisis situation because we have not cared for ourselves along the way.
So I am excited to have this conversation today. So I have with us Dr. Ingrid Waldron, who is an author, a professor, a researcher, all of the things. And we'll be speaking about racial trauma and its impact on mental health. And this is especially important, especially because this month is National Minority Mental Health Awareness Month. So the more we have these conversations about how mental health, how our experience as Black folk in the Americas impact our mental health, I think the more we know, the more we can do better and we can move forward. So before we hop into the conversation, Dr. Waldron, I always like to ask my guests, how are they doing PMS in this moment? And P is physically, mentally, and spiritually. You can go as deep or as not as you want to.
I'm doing very well. I have a lot of work on my plate. I have a lot of projects. That's my fault. I took on a lot of projects. So trying to deal with everything is difficult, but I'm going to have a bit of a break.
Nice,
Yeah.
nice. So I'm really excited to speak today. So let's talk about mental health and how and why it looks differently in our communities. So there's a broad question. So yes.
Well, I think one of the main reasons it looks differently in Black communities is because of the stigma. There's stigma in many communities around mental illness, but I think there's a particular stigma in Black communities that I found not just in the literature, but also just in my studies in terms of what people have said to me, whether or not they hold the stigma or whether or not the stigma has come from their culture or their family members. And that stigma around mental illness means that we are often less likely to seek help. So that stigma is very much kind of embedded in African culture, I would say, and also in this tendency to rely on God and spirituality among Black people of the diaspora. And that's not a bad thing to rely on God. Um, but oftentimes, Black people feel that that's all we should rely on, even when a Black person is suffering from extremely serious mental illness, such as chronic depression and bipolar disorder or schizophrenia. The answer is often just pray harder,
Yep.
pray it away, right? So there's a particular stigma around mental illness, first, I would say, in the Black community, because of this notion that those who have a mental illness are somehow weak. And I've heard this several times in my studies. They're weak. Um, some people see it as a white person's thing. Black people were strong. We hold this, certainly this image in our heads, and other people hold it as well, that we are strong people. A good thing, yes, positive, but also has its disadvantages. When people always see you as strong, then they never see you as somebody that they need to have empathy for or sensitivity to, and therefore less care is given to us. So it's problematic in a way. So I think those are some of the reasons why mental illness looks differently, is because of the core beliefs that we have around how mental illness originates, how it should be treated or how it should not be treated. Many of us think that it should not be treated. So I think it's something really difficult to overcome, and it's one of the reasons why we are less likely, of course, to seek help. But when we don't seek help, then we often end up in emergency or psychiatric facilities at a crisis stage, right? Because we're not taking care of our mental health along the way. So then we get to these situations that we see in the United States and certainly in Canada over the past few years, where there's a crisis, a mental crisis in the home. Someone has a crisis, and either a family member or friend calls for help, and the police inevitably comes, and we know what often happens when there's an entanglement between Black people and the police. It often, in Canada, there are lots of instances where it's ended in death, right? So that fear that police and just people in general have of Black people, and particularly of Black people who are mentally ill, there's an increased fear of that. And of course, Black people, unlike white people will say, yes, the police are here to protect me. We have, white people have a different understanding of police, is that they're there to protect.
Yep.
Whereas for many Black people, they're there to harm. So those expectations that the Black person holds and then the police hold, and then they start to interact, often leads to a dangerous situation or to death. So that just speaks to the fact that we tend to leave our mental health issues to the extent where it's in a crisis situation because we have not cared for ourselves along the way.
Yeah. Very true. And what I have also seen is that not only are our spirit, like our core spiritual beliefs, a part of why we take more time, if at all, to seek mental help, but there also is that history, right, within the medical system that has perpetuated harm to our people. So we've held on to that. So how do we like when the racial bias does show up in clinical settings, why do you think that we are most likely to be things like misdiagnosed, not heard, medically gaslit, things of that nature? And how do we even combat it?
That's a great question. It's kind of one of my favorite topics in the book. I talk about schizophrenia in particular, the overdiagnosis and misdiagnosis of schizophrenia in Black men and Black women as well, but particularly Black men. And there's a really great book by Dr. Jonathan Metzl. He's at Vanderbilt University in Nashville, wrote a fantastic book, 2009, called The Protest Psychosis, how schizophrenia became a Black disease, because indeed it used to be a white disease, and it slowly became a Black disease, particularly during the civil rights era of the 1960s. So I talk about that in my book. I've noticed that in some ways, just in terms of people I've spoken with, and also during my PhD, where every participant that I recruited happened to have schizophrenia. So yes, there's a real issue with maltreatment of Black people in the medical system, in the mental health system, and particularly with psychiatry. And my book was really written as a critique of psychiatry. I certainly wanted to look at things like, help-seeking behaviors among Black people, belief systems. I find all of that fascinating. But what I really find fascinating is the ways in which psychiatry and other mental health professionals have looked upon the Black body and have treated Black people through the years. And I kind of focus on the age of enlightenment, the scientific revolution, where negative stereotypes, harmful stereotypes of Black people, the Black body, were first construed. This notion, first of all, that Black people couldn't possibly have mental illness because they come from African cultures that were too unsophisticated, too uncivilized, too backwards to have a mental illness, and only the sophisticated and civilized individuals can possibly suffer from a mental illness. So, when I take schizophrenia, I would say back in the 1930s, schizophrenia was typically an illness that was applied to white women. Why? Because white women during that time, they would say, were dealing with role strain, whether or not I should be a housewife in the home taking care of my family, or whether or not I should be going out to work. So the theory was that they were stressed by the decisions that they had to make about whether or not to be a caregiver in the home or going out to work. And then, interestingly enough, that changed, and and schizophrenia started to be applied more to the intellectual, the white intellectual, the poet, right? The intellect. So when we think of a movie, we think of a movie like the one with Russell Crowe. What was it called? A Beautiful Mind. I believe he had schizophrenia in that movie, and he was a poet intellectual. So I would say from in the 1950s, it was applied mostly to the white male intellectual. And then interestingly enough, in the 1960s, where we saw the Black Panther movement and Malcolm X and all of these civil rights movement, and we saw Black women and men, but it was focused mostly on the Black men, seemingly looking belligerent and angry, of course, because they were resisting the racism that they were experiencing. They coined this term called Negroid schizophrenia, specifically for Black people, Negroid schizophrenia. And that's when, and I would say up until today, that diagnosis of schizophrenia has been applied mostly to Black men. I'm not saying that some Black men don't have schizophrenia, but I find it very interesting. And you could see this in Jonathan Metzl's book. But there's so many studies on this in the United States and in the UK, particularly by Dr. Suman Fernando. He talked about the racism in psychiatry and the tendency to over-apply that diagnosis of schizophrenia to Black people and Black men. A dangerous, I would say, a dangerous diagnosis only because of how people view schizophrenia, which is sometimes off the mark, but it's seen as the kind of worst illness you can have. It's seen as highly violent. It's seen as highly pathological. And it follows you. Mental illness can follow you throughout your lifetime, particularly in the workplace. So we have Black men who already have barriers in employment, structural barriers they face in this world. And to have a diagnosis that like that apply to them and to follow them throughout their lives is particularly harmful. And if you're dealing with somebody who you think is has schizophrenia, which is, as I said, often seen as a violent, aggressive mental illness, which is, I've been told it's not. The way then to treat people, you think, is more aggressively with a lot of medication, over-medication, which a lot of Black people in the United States have talked about, being over-medicated. It's a way to control that Black body, to ensure that that Black body surrenders. So I feel like the pathway to care, whether it's from a crisis you have in your home and then you end up in a psychiatric facility because your mother called the police, or just the handling of Black people within psychiatric facilities is often more hostile, more aggressive because of ideologies that are fixed in people's minds about Black violence and Black aggressiveness and Black hostility. And in the end, psychiatrists are simply people, and they are vulnerable to the very same stereotypes of Black people than everybody else is. And those stereotypes inform how they behave and how they treat Black people.
Really and truly. When I was in medical school, one of my rotations was, of course, in psychiatry. And before I got to school, I was leaning towards like mental health. But that rotation just really left such a bad taste in my mouth, only because of how the patients were treated. It was very much like, it felt like I was in a prison when we went in, and just the lack of care, the hostility. Like, these are patients like who are in crisis. Many of them were very young too. Like, at the time they were like my age, even younger, like 18, 19, 20, 21 year olds who were, and when I spoke to them to get like their history, like they had gone through so much trauma. And just their treatment while there was just so ugly. And I'm like, oh my goodness, the person that my preceptor was just, like, it was.
Can you describe the treatment? I'm very curious.
The hostility. So when they would come in and we're doing medication management, and the patient wants to talk to the psychiatrist because like, hey, I've been feeling this or that. Like, it's like, no, you weren't. It's like barely any eye contact with the patient. They're looking down at their notes. They're charting the whole time. And just my preceptor, when it was just us and the students, like he was fine, like actually really mild mannered, very gentle. But whenever the patients came in, and we were in the men's section of the psychiatric facility, like it was just he just turned into somebody totally different, and just, I did not see any care, no bedside manner whatsoever. It just made me feel just so gross. When I went home, I just thought about the patients a lot, and just like, I just felt sad that they weren't getting what they needed. And when I was speaking to the nurses on the floor, they were saying that, oh yeah, these people are repeats. Like, we would see them, like, we know they're going to come back in like another 8 weeks or so. So if this is like, they're in a psychiatric facility where it's for crisis, so clearly something is not being taken care of, that they're here.
That's right. That's right.
routinely. So it just,
Yes.
yeah, it just felt like
So that's another reason why we're hesitant as well. I forgot to say that at the beginning, is because of the bad treatment that has been meted out to Black people who don't
yep,
want to return,
yep,
not
yep.
surprisingly.
Yep.
Yeah.
And just in speaking to them, a lot of the issues were social. Like if I don't
Mhm.
have like adequate housing, if I don't
That's
have a way
right.
to get my prescriptions filled or whatever it
That's
is,
right.
of course I'm going to be right back
Yes.
here. And it's
Yes.
like, what can we do to help
Yes.
support them outside? Because maybe we wouldn't get to
Yes.
crisis if.
And I discuss that in my book. I talk about upstream factors, public decaying infrastructure in Black communities, low income in Black
Yep.
communities, unemployment in Black
Yep.
communities, housing insecurity, food insecurity. What I argue in my book is if you are a mental health practitioner, it is your job, it is your responsibility to form those partnerships, not just inside the hospital. Yes, doctors do a great job of forming those partnerships with social workers
Mm-hmm.
and dietitians and psychiatrists within the hospital, but it's also your job to forge partnerships with people outside the
Yep.
hospital because many of the issues that psychiatric patients are facing are due to the structural determinants of health. It's
Yes.
due to not finding employment. It's due to discrimination and racism. It's due to those upstream factors. So that means that you have to be willing and prepared and skilled to be able to forge those partnerships with the employment center, with the
Mm-hmm.
food bank, with the legal clinic down the street in order to address the issues that your patient is facing. Or else that patient will continue to come back to you
Mm-hmm.
because your empathy and your sensitivity is great, but is not going to help that person who continues to have ongoing issues trying to find a job.
Oh man. So let's talk about how racism in and of itself is a health crisis. So how do our everyday experiences as Black folks, so discrimination, microaggressions, and structural inequalities, how does that show up in our bodies and in our minds?
You know, it can't not show up, and there are a lot of maybe there are some Black people as well, but there are a lot of white people who don't get it.
Mhm.
Um, they have yet to validate, particularly once again, healthcare professionals validate racism as a real valid determinant of health that can lead to poor health outcomes. They're doing better in the United States because at least in the United States, there's race-based data. We don't have that in Canada. We've been
Oh,
calling on
gotcha.
that for over 20 years. We can't say, as you can in the United States, you know, Black men are disproportionately impacted by prostate cancer.
Mm.
We can't say that in Canada. You can. Um, so for me, it's kind of obvious that, you know, when Black people are experiencing overt or subtle or systemic forms of racism within all our social structures, healthcare, labor, employment, criminal justice, that's going to have an impact on the ground on their mental well-being. Those are experiences that they often internalize and that have an impact first off on emotional well-being that can then lead to more serious illness like mental health problems or
Mhm.
mental illness at the extreme. You know, those who don't want to legitimize racism will not admit that, but we all know that we hold just negative experiences in our body. And that often when we feel low, we feel down, we feel depressed, don't we sometimes feel that in our body?
Yeah. The
And
chest.
if we feel
Yeah.
discomfort and pain in our body, don't we sometimes then feel that emotionally?
Yeah.
That's the mind body connection that we
That's
often
right.
talk about. That's real,
Yep.
right? And it's an Eastern African understanding, but Western societies now embrace yoga and mindfulness healing, and they now understand that mind body connection, right? The traditional Euro Western approach is to separate mind from body. But now we see that white people, Euro Western culture has embraced what they call alternative forms of healing. They're not really alternative in other countries, um, but they're understanding that, right? We can feel racism at a visceral level,
Mhm.
and it's ingrained within our cells,
Mhm.
and we hold it in our body, and it causes sickness, not just physical sickness, but also mental illness. So when Black people and other racialized people are experiencing ongoing assaults on their minds and their bodies from racism in every social structure, that we can talk about. Of course, unless we are not human,
Right.
of course we're going to feel it. We're going to feel it emotionally. I can give an example of myself when, my early 20s, I had experiences with, employment discrimination. And I continued to go up for jobs, promotions at this particular um, this particular job that I was at for a long time, and kept being passed over for promotion, even though I was the only person in my department with an undergraduate degree. I just had an undergraduate degree, and I saw people with high school diplomas getting promoted over me. And at one point, it was just kind of enough. And I remember going home. There was this job I really wanted, and they gave it to this woman with only a high school education, and I had had enough. And I entered my apartment with my high heel shoes on and my suit on, and I threw myself down on my bed. I remember so much, and I wept. I didn't cry. I wept. I had had it because I was being overlooked for years at that employment. And I remember I spent a lot of time blaming myself, which is what kind of racism does. We first turn it on ourselves. Maybe it's me.
Yep.
Maybe it's you, Ingrid. Maybe you didn't have enough. Maybe. And I'm saying to myself, but I have an undergraduate degree in psychology from McGill University, considered to be the best university in Canada. And yet these high school graduates are getting these jobs over me. And I said to myself, no, this can't be me. And that led me down the path that I'm on right now to really focus on racism. I'm sure people are sick of it, but I'm obsessed with focusing, yes, on racism. And I know it's problematic these days. People have turned their backs on racism, but I continue to do that work. So that's just an example to you. I think if we were not human beings, then we can say that we don't feel this.
Yeah.
It's impossible not to feel it. And while I was lucky that it didn't turn into serious mental illness, or I didn't get sick physically from it, people do get sick physically from it, and they do.
Yep.
They do kind of fall into serious mental illness if they don't have supports or they're not resilient. I'm not saying I had supports. I didn't necessarily share it with anybody. My mother was born in Trinidad in a Black dominant society. She wouldn't understand. I just happen to be a resilient person, but not everybody is. And some people, how they could respond is that they don't want to get up from their bed every day. They want to close the blinds and not get up, and it paralyzes them. It didn't paralyze me, thank God, but it can do that. So for me, it's very serious. And for me, I'm a bit frustrated. I think it's time that mental health practitioners start to validate more the legitimacy of racism as a mental health stressor and as a mental health, that it can lead to mental illness.
Yeah, absolutely. Oh, absolutely. So I think, I think today, or was it yesterday, was the 5-year anniversary of the unfortunate tragedy with George Floyd. And so that like sparked the whole, it popularized the Black Lives Matter movement here in the US. And because of all of that, so many changes were made that have now been undone, right? So much has been undone. What do you think is a way for us to move forward in order for us to be seen, to seek treatment, and then when we do seek treatment, to get the proper diagnoses, to not be gaslit, all of those things? What's the way forward?
Well, things have certainly started to come undone in the United States. I see what Trump is doing. He's doing it very quickly and efficiently. And it's being done in a very overt way, in a way that makes people angry. While it's not as overt in Canada, I've just noticed a silence. We had the same thing. Various universities put out statements saying we're going to do better. They're going to get on EDI, etc. There was a lot of what we call cohort hiring at various universities. They would hire 20 Black faculty at the same time. And that was happening. That became a trend, a great thing, but that seemingly has stopped because I'm still on all the boards, the job boards, to see what's happening. So it's been being done, that dismantling, in a much more subtle way in Canada. It's much more silent, but I don't see a lot of progress. When these things happen, sometimes students will say to me, I feel frustrated because nothing is happening, Dr. Waldron. You tell us about all these problems, but in Canada, nothing ever seems to change. And I say to them, please stay on course, because that's really all we can do.
Yeah.
This Donald Trump era that you have will come to an end.
I pray so.
And if a Democrat comes into power, they may switch back to maybe not fully, but switch back to how things are. So I see this as an era, lots of undoing, but I think things can turn back to the way they were almost, or even better, when he's gone. And I feel the same way in Canada. So I always say to people, stay the course. Don't get distracted. Yes, these things get me down. This is my area, EDI, diversity, race. And sometimes I feel like it may be harder for me to get those grants or to do what I want because of the kind of turnaround. But I always remind myself that I can't get distracted. I need to stay the course. I'm going to continue doing what I'm doing, whether or not it's cool or hip or relevant. This is what I want to do. This is my passion, and this is what gets me going. In terms of the mental health component, it's to continue, I would say, to advocate once again. I know it's difficult. It's difficult to do that, but it's to advocate. And even during that time, when things were being dismantled, I saw some really interesting initiatives popping up in Canada solely for Black people. Example, the Sisterhood Initiative in Nova Scotia that came out of a research project I did, a research study on Black women and mental illness. So I did that, as I said, in my PhD, but back in the 90s. But in 2019, I did a study on Black women in Halifax, mental health experiences, and help seeking. The Black male social worker who came to me to ask me to do that study said, Ingrid, we have the Brotherhood Initiative, which is a health service for Black men. Some Black women are complaining and saying that they want one for Black women. Ingrid, if you can do a study on mental health of Black women, and you can give that data to the Nova Scotia Health Authority, they promise that they will launch a sisterhood initiative, a health service specifically for Black women for all of Nova Scotia. I said about doing that study. He said, Ingrid, you don't need to have a lot of participants. We just want some data. And I finished that study in 2020 and sent it to Nova Scotia Health Authority, which isn't necessarily government. It's considered kind of non-government, but it deals with policies and different things around health in Nova Scotia. And in 2023, it was launched. Now Nova Scotia and probably Canada has the first and only health service for Black women. There is a health service for Black women and women of color in Toronto, and that's existed for over 20 years, but that's for women of color as well. This initiative in Nova Scotia is for Black women only. As I said, we also have the Brotherhood Initiative only for Black men, and they're both working really well. So this is an example to me of Black resilience and Black excellence, and the fact that we should not always rely on those broader institutions to respond to our needs. We don't want to let them off the hook. Trust me. I don't want to let the Canadian mental health system off the hook for them to say, okay, Black people are dealing with it, so we don't. We all have a right to good health care.
As your work is about something really, really serious, you're talking about hard things a lot of the time, racism, right? And how it impacts us in all the ways. How are you finding joy these days? So what are you doing to just spark some joy into your life?
Well, like many people, the work-life balance is hard for me. I have a very demanding job. I have a lot of studies on the go. Once again, my fault. Always, maybe it's being Black once again, always trying to prove myself, which I don't need to do at this point, at this age, but I think that's part of the Blackness. So it's hard, but I have a group of girlfriends where we go out often. They have to remind me to do that. And to be honest with you, it doesn't really take much. I wake up every day feeling, which I think I took for granted in the past, but I wake up every day feeling blessed and happy that I woke up,
Mm-hmm.
that God allowed me to wake up, that I don't have a disability, that I'm mobile, I can get up from my bed. And maybe it's because of people around me. There are people close to me that now have some health issues, not mental
Mm-hmm.
health, but health issues.
Mm-hmm.
And I look at that and I say, Phew, um,
Yeah. Yeah.
I feel lucky, I feel blessed, and I feel like, what do I have to complain about? So I honestly, every morning when my eyes open, I say, and I think if people do this more, they can come to a level of happiness. I woke up this morning because he didn't have to allow me to wake up. I
Mm-hmm.
woke up this morning with, from what I know, with health.
Yeah. Yeah.
Right? We don't always know. I've got to go to the doctor. You never know what you have, but
Mm-hmm.
I feel healthy and I feel strong and I can get up from my bed. What do I have to complain about? I guess you call it gratefulness, which
Mm-hmm.
I've never kind of thought about in the past, but maybe because I'm getting older.
Mm-hmm.
It makes me happy to know that I have all these blessings.
All right. So the last question that I have for you is, of course, I'm going to have the link down below for folks to go purchase the From Enlightenment to Black Lives Matter, tracing the impacts of racial trauma in Black communities from the colonial era to the present. So I'll definitely have this down below for folks to go purchase. And where can people find you and support your work online?
They can support me at my McMaster University website. If you type in Ingrid Waldron McMaster Experts, you'll get to a webpage for me. I'm also on social media, so people can find me on LinkedIn, Twitter, Instagram, and Facebook. I'd also say just that this was the book that I always wanted to write that I never got a chance to write. People ask me, why did I write it? Well, I graduated with my PhD way back in 2002, and time got away from me. I had to find a job, never had a chance to
Mm-hmm.
write a book based on my PhD. And some of this comes from that,
Mm-hmm.
particularly the historical aspects of the book when I talk about the Enlightenment and the colonial era. So this is the book I always wanted to write, and it's finally been written. And I just hope people get it. And I'm really interested in hearing any feedback on the book from individuals who have read the book.
Yes, absolutely. Thank you, thank you, thank you. I'm so grateful for your time today. Thank you for listening to this episode of Be Well Sis. If you'd like to get in touch with us, there's a link in the show notes. Be Well Sis is hosted by me, Dr. Cassandra Dunbar, and produced by Edit Audio. Don't forget to hit follow so you never miss an episode. Until next time, be well, sis.